So channeling that inner psychic, what major provisions do you think need to be addressed to ensure wider support across party lines?
Across party lines, I think that might be a bridge too far at this point. But what I guess I would say is that, and I think kind of going back to the two sides kind of pulling this issue, it seems like most of the debate right now is focused on the future of the market reforms. And those are things, that really had gained a good bit of support and that people recognize, right? People at home know an insurance company can't deny you because of a pre-existing condition or charge you more because you're a woman. And those are things that, the Freedom Caucus is looking to really return to the states in terms of flexibility. And so I think they will need to find some kind of deal on how the insurance market is regulated. And sort of once that's off the table, then I would imagine the debate returns to the Medicaid provisions in the bill that's being debated, which are highly controversial, that would leave states with significantly less funding, and of course would make states then choose whether or not to raise taxes or take some kind of other step to bring in more money or actually decrease enrollment or benefits for the people enrolled.
Bob, do you see a gang of 18 or some group of legislative leaders splitting the baby in half in a meaningful way? Is this navigable?
I'm not sure. I'm frankly not sure. My prediction today, and I guess it's now on camera, is that a year from now we'll still be under the Affordable Care Act. It may be modified, but we'll still be under that. And I think it's because many of the changes that would make the HCA acceptable to larger or different constituencies, maybe not larger constituencies, but different constituencies on the Republican side of the aisle, may be unacceptable to their constituents. And I don't know that they will be willing to pay that political price. Now that's my personal view. It's not my organization's view. It's my personal view, and I think because of that difficulty, that they will in some ways be disadvantaging some of their own constituents and a major set of their constituents that tended to vote for them, that they may find that not politically acceptable.
You asked about bipartisan solutions, and I was a little flippant. And in my core, I am inherently bipartisan and a policy nerd, so I'd like to believe it's possible. So I do want to be clear about this, that there are a set of reforms that could be capable of achieving bipartisan support, but they would focus really on stabilizing the Affordable Care Act, right? So additional support perhaps for reinsurance programs or other kinds of state-based risk programs are something that could gain traction and make the market more attractive for insurance companies. Some of the market reforms perhaps to let premiums vary more based on age is something that has been viewed as potentially bringing more younger, healthier people into the market. Certainly focusing on fixing, and this is kind of nerdy, but it's a problem certainly for our health plan colleagues here, fixing the risk adjustment mechanism to make sure that it is accurate and compensating plans appropriately. Those are things that could really shore up the existing Affordable Care Act. And if members on both sides of the aisle decided that was their goal, there is certainly a path forward there. It's just a question if Congress gets to that place or not.
John, predictions?
I wish I had good predictive ability. If I did, I might not be in this job. But I think what I hope is, and I think this may be a forlorn hope, is that calmer heads will prevail and we'll make the modifications that preserve the access that people now enjoy. This notion, Rand Paul's father, a representative, he was an OBGYN physician from Texas, when asked about healthcare coverage, said, well, if people don't have insurance, they can do soup suppers and spaghetti dinners, and healthcare is just too expensive today, and it can ruin families. Diseases already ruin families. We don't need finances to do the same. And so I think you've outlined several key things that can be done to stabilize it. I hope that's the calmer set of heads that prevail in all of this. And I think representatives and senators recognize from the feedback they've gotten in their districts, in the meetings in their districts, that there is a lot of emotional energy built around this. And so I'm hoping that will translate into calmer heads.
Well, and there may be a catalyst for this. So we've seen in Tennessee that there are 16 counties that won't have an insurance company on the exchange next year unless someone else comes in. Republican senators Bob Corker and Lamar Alexander have introduced legislation to allow individuals to take kind of the financial tax credit assistance provided under the ACA and use it to purchase a plan off of the exchange. I think we will see additional counties and areas in the country sort of faced with that challenge, and it may be sort of this catalytic moment to say, you know, what are we doing here? You know, we're kind of putting a Band-Aid without really addressing the problem, and so there will be several inflection points, I think, in this debate, and certainly carrier participation for the 2018 plan year will be one of them.
Interesting.